Sometimes women come with the problem of bleeding between two periods. They say that they've got a few days of bleeding, 2 to 3 days of scanty bleeding between two periods, proper periods. This is what we call mid-cycle bleed or Mittelschmerz or ovulation bleeding. Sometimes when a woman ovulates, that is an egg burst from her ovary, there is a little bleeding there. That blood is picked up by the fallopian tube and thrown out from the uterus, which she sees as a mid-cycle bleed. This is not common. This doesn't happen to everyone, but this is normal. If a woman is looking at fertility, then yes, the mid-cycle bleed may interfere with her conceiving. So in this case, we see whether there is a vitamin D deficiency, which leads to a calcium deficiency, which is the reason why she's having so much bleeding, because calcium is important in the coagulation cascade. It is important for blood to clot. Correcting the D deficiency corrects this bleeding, unless she has some other bleeding disorder, which has to be looked into. Some women complain of bleeding after having intercourse. This is postcoital bleeding. This happens if there is an ulcer on the cervix. Now, an ulcer on the cervix may be just that the inner lining of the cervix has come on the outside, what we call a cervical eversion or an erosion. Now, this inner lining is a thin single layer lining which secretes fluid. It can easily get infected. So, all this inflammation and infection leads to bleeding during intercourse, after intercourse, or it leads to what we call postcoital bleeding or bleeding after intercourse. It can lead to irregular bleeding in between at any time, and it needs to be looked into. Rarely it can be a cancer, in which case a pap smear or a cervical biopsy will demonstrate the cancer, and then proper treatment has to be taken. Some women have bleeding piles, and or they have a urinary infection and they are passing blood in urine, and they mistake it for vaginal bleeding or menstrual bleeding. So that also has to be clarified. Very rarely it's a woman who is pregnant, who doesn't know she's pregnant and she has bleeding, she is aborting. So a pregnancy also has to be ruled out in irregular bleeding. These are all the causes why a woman has some kind of irregular bleeding, and each cause has a separate treatment.